My Heart in My Hands. A campaign created by women, for women. Why? Because heart disease and stroke are leading killers of women in Newfoundland and Labrador. Because more than 1 in 4 women from our province die of heart disease and stroke. Because heart disease and stroke kills over 6 times more women than breast cancer in our province. Yet many women do not recognize it as a major threat to their health. Women are more likely than men to delay treatment because they are so busy taking care of everyone else. We can all be affected by cardiovascular disease. Here are the personal stories of 3 women living in Newfoundland and Labrador.
I am Sheila Farrell. I am 60 years old last week. And I was born and grew up in downtown St. John's, and I lived all of my life here. 5 years ago, I had a stroke, and it's changed my life completely.
Hi, I'm April Manuel. I'm a 47-year-old lady, and I'm initially from Charleston, a little small community, 400 people around the bay, as they would say, but I'm currently living in Conception Bay South, it's Newfoundland. I grew up with heart disease as something that's normal in our family. Being from a typical outport and having the diet that we have, it was normal for me to see everybody around me dying from heart disease. So that's what our family died from. You know, OH was coinciding with heart disease.
I'm Barbara, or Barb, everybody calls me Barb, Baldwin. I'm 70, will be 71 in May, and I live in St. John's. In June, 16 years ago, I underwent bypass surgery. Quite an experience, but I got through it. You know, it was a little bit devastating first, like why me? Like I think that all of us will probably say the same thing. But anyway, went through the rehabilitation of it all and joined the cardiac rehab that was sponsored by Eastern Health, and met thousands of wonderful people, let me tell you, who all had the same problem.
It was April 2nd, 2010, and I could not move out of my bed. I was home alone, and I think I lay there for 4 hours, 4.5 hours before somebody came home and find me. When you have lost your ability to walk and talk and eat, you have known what can leave you at any time in your life.
I'm the only one. In all my family, even my cousins, they all are on antihypertensions or something for their cholesterol. That has sort of, I feel lucky that I have not have anything signs and symptoms of heart disease.
I know there's all kinds of risk factors: lack of exercise, eating properly, smoking. I did smoke, sad to admit, many years ago when I think it was the fad thing to do, you know. But since then, and even before, I walk a lot, exercise a lot, and hopefully try to eat right most of the time.
I'm really cognizant or aware of my risk factors. You know, I don't drink. I go out and have a social glass of wine. I run 3 times a week. You know, I'm very physically active. I've really taken responsibility for my own heart health. And literally, I have my own heart in my hands because it is my responsibility. You know, I have a young child who's going to grow up, and I want to be there for him.
I would certainly encourage every woman to take care of their own health, their own heart. If you're having difficulty, any kind of difficulty with regard to heart, see your doctor. Let them refer you to a cardiologist. Have a stress test. It's no big deal, but at least if something is going on in your body, you'll take care of it before something drastic happens to you.
My personal message is that heart disease doesn't have to be normal. Obviously, it's something that we live with, but there's things that we can do to decrease the risk of it. And that's what I encourage people to get out and get moving.
If you can help it, don't let other people bring you down. Stress is not worth it. I know that now, but I didn't know it when I was going through it. But stress is not worth it. And protect yourself. Protect yourself and take the time off for yourself. Go to checkups. Go take your exercise and eat healthy and educate yourself and get rid of the stress in your life that you carry home with you.
Presentation 1, Women and Cardiovascular Disease. Cardiovascular disease includes diseases of the heart, the blood vessels of the heart, and the system of veins and arteries throughout the body and within the brain. Cardiovascular disease has many causes, but it usually involves narrowed or blocked blood vessels, a condition called atherosclerosis. Atherosclerosis can affect any artery in the body, including arteries in the heart, brain, arms, legs, pelvis, and even the kidneys. As a result, different diseases may develop based on which arteries are affected. A heart attack occurs when the blood supply to the heart is slowed or stopped because of a blockage. It is important to recognize the signs of heart attack. Call 911 if you are experiencing any of the following: chest discomfort, uncomfortable chest pressure, squeezing, fullness, or pain, burning, or heaviness. Discomfort in other areas like the neck, jaw, shoulders, arms, and back. Lightheadedness, shortness of breath, nausea, and sweating. Do you know the difference between heart attack and angina? Angina is caused by reduced blood supply and oxygen to the heart. Angina causes the same symptoms as heart attack, but unlike a heart attack, does not cause permanent damage to the heart. In the same way that narrowing or blockage of the arteries can cut off oxygen-rich blood to your heart, it can also cut off blood supply to the brain. Stroke is a sudden loss of brain function caused by damage to a part of the brain. 4 out of 5 strokes are caused by reduced or stopped blood flow to the brain. Stroke is a medical emergency. Act fast. Know the signs of stroke. Face, is it drooping? Arms, can you raise both? Speech, is it slurred or jumbled? Time to call 911 right away. What are the risk factors for heart disease and stroke? There are some risk factors that you cannot control, such as family history, age, and ethnicity. You also cannot control your gender, and as women, we also share additional risks for cardiovascular disease. Women's unique risks include menopause, pregnancy, and oral contraceptives. Menopause increases your risk for heart disease and stroke due to declining estrogen levels. Complications associated with pregnancy can increase a woman's risk of heart disease and stroke up to 3 times. If you are currently pregnant or planning on becoming pregnant, discuss your heart health with your doctor. In a small proportion of women, oral contraceptives increase the risk of high blood pressure and blood clots. The risk is greater if you smoke, already have high blood pressure, and are over the age of 35. But there is good news, ladies. There are risk factors that you can control. Controllable risk factors include obesity, smoking, high blood pressure, diabetes, stress, high cholesterol, physical inactivity, and an unhealthy diet. Obesity, including carrying excess weight around your abdomen, is associated with an increased risk of type 2 diabetes, high blood pressure, and high blood cholesterol. Our province has the highest obesity rate in Canada, with half the women being overweight or obese. Smoking has negative effects on your overall health, and it increases your risk of heart disease and doubles the risk of stroke because it increases blood pressure, it reduces blood oxygen, and it blocks arteries. Our province has more daily smokers than the Canadian average, and 1 in 4 women smoke. When you have high blood pressure, your heart has to work harder than normal to pump blood through the blood vessels. High blood pressure is a leading cause of stroke and increases heart disease risk up to 4 times. Our province has a higher than average prevalence of high blood pressure, and 1 in 4 women aged 45 to 64 reported having high blood pressure. If you have high blood pressure, it's important to check it on a regular basis and to take your medications as prescribed. Diabetes increases the risk of heart disease 3 to 7 times, particularly if your blood sugar levels are poorly controlled. It can also result in circulation problems caused by damage to the blood vessels. Women with diabetes are also much more likely to have heart attacks or heart surgery than men with diabetes. 4 out of 5 people with diabetes die of heart disease or stroke, and our province has the highest death rate due to diabetes. If you have diabetes, be sure to maintain your ideal blood sugar level as set by your physician. Stress is another controllable risk factor, which can lead to poor lifestyle choices, such as avoiding exercise and eating poorly. Stress may lead to higher cholesterol and blood pressure levels. In our province, 6 out of 10 women over 12 years of age felt their lives were stressful. Cholesterol is a fat found in your body and your bloodstream and is naturally produced by your body. However, high cholesterol increases the risk of narrowed arteries and blood clots. High cholesterol also has no symptoms. Approximately 40% of Canadian women have high cholesterol levels. Know your cholesterol and triglyceride levels and discuss them with your physician. Inactivity is another controllable risk factor that increases your risk of heart disease twofold. And inactivity shaves 2.5 years off a person's life expectancy. Approximately 1 in 2 women in our province, aged 12 and older, were physically inactive. But the good news is, it doesn't have to be this way. By making healthy lifestyle choices, you can reduce your risk of premature heart disease and stroke by up to 80%. So go ahead, make the decision to be physically active. Eat a healthy diet. Achieve and maintain a healthy weight. Be smoke-free. Manage stress. Lower your cholesterol. Manage diabetes. Control your blood pressure. Limit alcohol. Know the warning signs. Visit your doctor on a regular basis. And take medications as prescribed. And remember that small steps can make a big difference. You can reduce your risk factors. You have the power. And you can do anything. And you deserve it. The best years can still be ahead of you. Ladies, it's time to put you first, so that you can be there for them, and them, and them. Be there for each other.